Hey y'all, Shelly here with another tip for hospice nurses. Today I'm talking about documentation, specifically Alzheimer's documentation, and I'm going to focus on some areas that are a little bit more obscure. Some of the more obscure system assessments and assessments that we do that we can document in a way that will support Alzheimer's. Because, we all know about the neuro and the mobility and the elimination and all of that. So other things that we don't think about, though, would be, the first thing would be pain. And I'm going to full disclosure, y'all, I'm using my book right now. So I'm reading through the book in my copy. So that's why I keep looking down. I'm sorry. But the first thing we want to look at is pain. So this person should not be able to in any way do any kind of numeric pain score. So I will typically document on an Alzheimer's patient when I'm talking about pain. I will say, due to the progression of terminal end-stage Alzheimer's dementia, a patient is unable to qualify or quantify pain. Therefore, pain measured using PAINAD, which is PAINAD scale, which is a scale specifically for patients with dementia, but pain measured PAINAD score remained 0 throughout skilled nurse assessment. That may say a little bit more or less. Or if they have pain, I'll address it that way. But make sure that you do not document a numeric pain scale, because that would be in direct contradiction to hospice eligibility for an Alzheimer's patient. So the second thing you want to think about whenever you're documenting their nutrition, so much more than just documenting what they're eating. In this case, it's much more important that you document, first of all, the consistency of the food, because they're probably going to at least be on a soft diet, probably a pureed diet. And they're going to have the food all set up. They usually have to be fed. And frequently they have to be reminded to chew and swallow. So I will state something like that. The patient requires frequent encouragement to chew and swallow food. All food must be passively fed to patient, and talk about what type of the food and then how much they're eating. But it's real important that you talk about how they're being fed, because they're not going to be feeding themselves, at least not 100%. If they are some, then you want to state they require maximum assistance with nutrition, because they will, definitely. And then the last one, talk about their affect. So with Alzheimer's patients, a lot of times they are just not going to be able to effectively express their thoughts or feelings. So we look at their affect a lot. And I will sometimes even state that due to the progression of terminal end-stage Alzheimer's dementia, patient is essentially nonverbal and unable to effectively express thoughts or feelings. Affect remained calm and peaceful, affect remained agitated, or whatever their affect was. It's real important that we show that we are using our assessment skills to make sure that this patient is emotionally as peaceful as they can be. So I hope this tip was helpful. If you have any tips that you think would be helpful for hospice nurses, please let me know. I'd love to share them here. And remember, together we can change our world.